and that all people have access to health care. That that is our vision, that is what our hope is, that we will no longer live in a society where people are not able to access basic care, they're not able to get strong prevention services from the very earliest time of their life, and that they, when they need service and care, are able to access it. At Nokomis, we decided about 1.5 years ago that the women that we wish to serve, women who are low wage earners, women who go to work every single day, sometimes working 2 jobs, who are not able to take care of their own basic health care needs, are able to have that access. We conducted a listening and learning tour in 10 counties in Michigan where there is a prevalence of low wage earning women. And over again, we heard from them, yes, they would like to earn higher wages. They need some basic things like stable and safe housing. They need affordable, accessible transportation. And over again, to a person, they said healthcare was an enormous barrier to their economic self-sufficiency. They were either spending disproportionate amounts of their income on healthcare, or the reality was they were probably not getting health care because with the limited resources they had, their limited earning power, they were not able to take care of themselves. And in a community here in West Michigan, which prides itself on the value of family, on the value of our children, we all know that if you do not have a healthy mother, you will not have healthy children. I was very excited over the weekend to read an article on brain science. Brain science is teaching us so much stuff, and I won't be wonkish about brain science, but finally doctors are beginning to understand that children born in poverty, children born to poor mothers, not only have a disadvantage in terms of their physical well-being, they have a disadvantage in lifelong in terms of their emotional and spiritual and psychological well-being. That something happens to their brains when they're exposed to the violence of poverty. And that's what it is. Poverty is a violence that's visited upon the most frail members of our society. And women frequently comprise the bulk of those people who live in poverty, women and their children. So today, we're here to celebrate the passage of the Affordable Care Act, which provides all kinds of benefits to women and others, to senior citizens, to children, to young adults, and other speakers will talk about that. As we celebrate the passage, the birthday of the Affordable Care Act with our balloons and our packages, it's not only the birthday of the Affordable Care Act, it's not only Women's History Month, but on March 25th, it's the 100th anniversary of the Triangle Shirtwaist Factory. And there are historians who mock that fire really as the impetus and the beginning of all social reform that has taken place since then. Frances Perkins, who was FDR's cabinet secretary of labor, was eating dinner at a New York restaurant when the alarms went off for the Triangle Shirtwaist Factory, and she described leaving the dinner table and rushing to the fire. And in that fire, 146 Jewish and Italian immigrants, primarily women, perished. And that sparked in Frances Perkins a desire to make sure that nothing like that would ever happen again on her watch. She was a disciple of Jane Addams. Those of you who are social workers in the room know the value of the work that Jane Addams did. She too was a proponent of healthcare. So as we celebrate today the enactment of the Affordable Care Act, let's commit ourselves to the industry and endeavors that those women did. Jane Addams, Frances Perkins, Eleanor Roosevelt, and a whole host of other women who understood that those of us who live advantaged lives have to always make sure that we're looking out for the needs and the well-being and the health of our brothers and sisters who do not have the ability to access care that we do. There's a lot more that can be said. We're going to invite you to celebrate in a few minutes. It's my pleasure to introduce Erin Knott, who is with Michigan Citizen Action, and she's going to talk about consumer protection afforded by the Act.
Thank you. I'm gonna go behind the podium because I'm not feeling on top of my game today. I woke up Saturday morning with one heck of a chest cold, and I'm sorry if I'm not quite on top of it. I've been talking about health reform and the Affordable Care Act since July of 2008, when my organization, Michigan Citizen Action, received a contract from a national coalition called Healthcare for America Now to support champions in Congress and to put pressure on other members of Congress to reform our system, which was broken. And though we're celebrating today because President Obama signed the Affordable Care Act into law on March 23rd of 2010, the law as we know it, and we're just now starting to see some of the benefits, is under attack. Millions of Americans have been benefiting since September of 2010 from the Affordable Care Act. And what this means is insurers are no longer allowed to discriminate against children and others who are sick. Small businesses are receiving billions of dollars in tax credits to provide coverage to their employees. And seniors are saving money on prescription drugs and receiving free preventative care through Medicare. We need to work, all of us in this room, to change the public debate, to educate our friends and neighbors about the benefits of the Affordable Care Act, because as I said, the implementation just started in September of 2010, and most of us don't even realize what's going to happen by the time it's fully implemented in 2014, and right now that might not happen. So we need to work together to talk about what it would mean if Congress repeals the Affordable Care Act. And I'd like to tell you what that would mean in your congressional district, the 3rd district. So if the ACA, the Affordable Care Act, is repealed, that will allow insurance companies to deny coverage to approximately 118,000 to 309,000 individuals. In that includes 9,000 to 43,000 children with pre-existing conditions. Now, some of you might have noticed a young man in the room, Hunter, my son. He's here with a pre-existing condition. I no longer, because of the Affordable Care Act, have to worry about if I decide to change jobs, if I lose my insurance, if I lose my job because of the economy, etc., that I will not be able to provide care for Hunter and his condition. Furthermore, if the economy stays the way it is by the time Hunter gets through college, if he graduates under the Affordable Care Act as it stands right now, he can stay on my partner and my insurance up until the point he's 26, whether or not he's in college. And on that point, if the Affordable Care Act is repealed, as of right now, 2,400 young adults within this congressional district will lose the ability to be on their parents' insurance. Additionally, rescinding consumer protections to just over 468,000 individuals who have health insurance through their employers on the private market side. If the ACA is repealed, tax credits to up to 14,000 small businesses will no longer be available. Increasing prescription drug coverage to 9,900 seniors who are hit on the Part D drug donut hole. The donut hole will be shrunk, eliminated by 2014. And what we started to see in May of last year is senior citizens that are impacted by the donut hole received a $250 rebate check to help pay for their prescription coverage. If the ACA is repealed, that will no longer be available for seniors in our community. Eliminating the new healthcare law will also eliminate coverage, I already mentioned this, to the 2,400 uninsured young adults in our area. It will increase the number of people within Congressional District 3 by, I'm sorry, I'm so hazy with my cold medicine. It will increase the number without health insurance by 30,000 individuals within your community. And it will cost hospitals $63 million in uncompensated care on an annual basis. These are just some of the consumer protections. Again, I've been doing the road show since July of 2008 talking about the benefits, and when we cut the cake and celebrate in a minute, if you want some one-on-one time, I can talk to you in more detail about what the CARE Act provides for you and your family. But really, I think the closing message that I want to leave with you is it's time for us to move forward and to talk about what it means for all of us: pre-existing conditions, prescription drug coverage, free and preventative care for seniors, tax credits for small business owners, and as Mary had mentioned earlier, the fact that women can no longer be discriminated against as it relates to what they pay in premiums just because they're a woman and they might be pregnant, not pregnant. So in closing, we need to protect every American and talk to our friends and neighbors about what this new Affordable Care Act means, so that we are in control of our health insurance and our decisions, and seek the doctors that we want to seek, and not at the mercy of the insurance companies and all of their bad practices. So I've kind of given you some numbers and briefly talked about the consumer protections in a very hazy fashion, but I think that there's a consumer here that could really talk about benefiting from the ACA already. And so now I have the honor of introducing Kin Fu. If you'd like to come up and talk about the act.
Thank you very much. Thank you. I'm truly proud to be here today. In a sense, I'm a board member on Cherry Street. I'm truly proud every day I go there. And of course, to talk about affordable health care, I am one of the benefactors of the health care. The act, I use the dental service. I've been using the dental service for the last 2 years. And the fact of the matter is, you know, we look around, we should be working full-time sometimes part-time, but it may not be affordable for all of us to pay all of that money for insurance. I think we have to find, especially for people who cannot afford. Mind you, we all have this picture about the poor, uneducated people who go to this handout, That's not what it is, really. It's shifting. The middle class actually is in a bind. The middle class cannot afford to spend all of that money to pay for insurance. So why don't we actually come up with a clear and precise way that a family can stay together, can afford to pay for insurance? I think this is a very important thing. So I think the celebration should be only the beginning. We should really push for a fight, we should stand up for this act. And I think in one way or another, we have to make it clear to our representatives that they have to give them the message that we want this act to stay. So thank you very much.
Thank you so much for sharing, both of you, your stories and the information. This is a celebration. It is a party. It wouldn't be a good reason to have all these people in a room without making a couple of pitches. Our partner in bringing all this together is Michigan Consumers for Healthcare Advancement. It's a nonpartisan, bipartisan group made up of individuals and organizations who are committed to seeing that solid healthcare policy is implemented in Michigan. The passage of the federal act is only a first step toward making sure that what happens in Michigan is also very solid for all of its citizens. And we know that a long battle is ahead of us. I alluded earlier to the fact that it took 100 years to get us to that day last year when we actually saw the president sign the bill. And now, in the interests of all of our citizens, we are looking for a way to implement the aspects of the Affordable Care Bill, which are delegated to the states right here in Michigan, and that's going to involve all of our voices. Michigan Consumers for Healthcare Advancement brings together individuals and organizations that have constituencies deeply impacted by it. We're inviting you to sign the poster that's on the easel in the back of the room, either individually or in the name of your organization. I invite you to consider joining either as an individual or as an organization. Michigan Consumers for Healthcare Advancement, there's more information about them out there so that you'll know what you're signing up for. But if you do sign the card that's over there on the easel, we are going to bring it to our Congressman, Justin Amash, to let him know that the voices of his constituents are very much in favor of the Affordable Care Act on the federal level, and that as citizens of Michigan, as constituents in his district, we want him to also be part of the education effort that we're carrying forth now. So we invite you to do that, and without further ado, we invite you to join us for cake and talk amongst yourselves about how this all fits into your organization. On behalf of the Nokomis Foundation, I thank you so much for taking time to come.